I'm your host, Eleana Kaidanian. I'm also a registered dietitian and a women's fitness specialist. I started hosting pregnancy events back in 2014 when I was expecting my firstborn. And at that time, I was practicing at a high-risk maternity clinic in New York City, mostly seeing patients with gestational diabetes. And at that time, I was invited to speak as a panelist at a small gathering targeted towards expecting women. Since then, I brought and expanded the concept to my own community on Long Island as an annual project for myself in between juggling work, life, and everything in between. Pregnant Island was born and quickly evolved from not just another mom event or a pregnancy event, despite the name, but an informative event spanning from preconception to pregnancy, birth, postpartum, and all the way to early childhood. We have had local health professionals from all subjects of expertise enlighten us on the most up-to-date research in their field, even showcasing local businesses as vendors that cater to growing families on Long Island while giving away prizes and having fun. Because who doesn't love to win something, right? So before we begin, please notice that you can type up any questions or comments in the chat box, and we will try to moderate throughout the event. The webinar is also being recorded and available on pregnantisland.com after the event. Just give me some time to update it as I figure out all this tech stuff. But without further ado, let's begin. So first off, I want to thank our attendees, speakers, vendors, and sponsors for collaborating and adapting to this event from a physical one to a virtual one in less than 30 days. Many people don't realize that Pregnant Island events take almost a year of planning. So of course, as your host, I've been planning this event since before August 2019. So far in advance that during this time I've become pregnant and I'm actually due in just 3 weeks. As a planner, I have professionally printed over 20,000 postcards and flyers that now just sit in my dining room and are considered to actually be a hazard against infection control during this pandemic if I were to distribute them. Along with goodie bag insert items, including baby bottles and pacifiers in the hundreds that I would have loved to give out to you all today, but they're just going to have to wait until our next physical event, which I hope will be in 2021. At the same time, I'm so thankful that we can continue this event online when so many others have been canceled or postponed until an unknown date. I'm also very proud that through the support of all of you, we could turn this event into a community effort. In the past, as some of you know from attending, we've hosted diaper drives that help local families in need. Today, we support the Sid Jacobson JCC of East Hills and their Essential Workers and First Responders Fund, supporting those on the front lines who are risking their lives to keep us all safe. Together, we are taking the initiative to provide meals and the necessary personal protective equipment to essential workers, which is truly amazing, and I really couldn't have done it without you all. Our virtual vendor lineup consists of several significant local businesses that can truly use our support just as much as we can use their valuable services. The Long Island Doula Association, Inc. is a multifunctional organization operating on the paradigm that birth is normal. LIDA provides evidence-based information and positive support for women in the early stages of motherhood from conception through postpartum. With 7 convenient locations, Kid Smiles is a state-of-the-art pediatric dental practice utilizing up-to-date technology, fun, kid-friendly atmosphere, and they participate with most insurance plans, teaching good dental hygiene. They're actually open right now, and they're seeing case-by-case patients. So if you need to see a dentist for your child, please reach out to them. We also have Slumberland Solutions here today. I saw Carla logging on. Carla Pearl is a certified pediatric sleep consultant. She helps families look at bedtime routines as night beginnings rather than day's ends. And as a result, the children who are happy, loving, and secure go to bed in a process that is comfortable and familiar and happy. We also have Dr. Dana, aka Chiro Mom. She is the superhero in chiropractic care, specializing in pediatric wellness and pregnancy chiropractic, as well as regular screenings and adjustments. She is also open right now seeing patients on a case-by-case basis. Brett Solomon actually joined our event back in 2014 at our first event in Great Neck. He is a nationally and New York State certified car seat technician, and he's the founder of Strapped-In Car Seat Safety. He's the only car seat tech on Long Island available for both in-person and virtual appointments, even now. He serves Nassau County, Suffolk, Queens, Brooklyn, Manhattan, and surrounding areas while offering car seat installations, car seat inspections, car seat checks, car seat help, and child passenger safety lessons. We also have insurance agent Marie Pierre-Paul. She's your go-to at New York Life in Melville. And she understands that every client is unique. So together, working with you, she can develop a personalized approach that meets today's needs as well as tomorrow's as well, especially during this time. Macaroni Kid Hicksville was founded with two very specific goals: enriching communities and empowering moms. They provide local activities, guides, and news for parents and families, even now, mostly virtual, of course, but definitely reach out to them or check out their website. And lastly, we can't wait for the 10th annual All Kids Fair, which has been rescheduled to Sunday, November 8th. The All Kids Fair showcases quality products and services for kids and their families, and we hope to physically see you there. If you've been following our Pregnant Island Facebook page, then you would have seen that we've been promoting weekly contests with real prize giveaways leading up to this event. Just in the past few weeks, we've given away a Mam Grow with Baby gift set, an e-gift card to Petty Pet Footwear, and a 1-month diaper subscription from Diaper. We also saved several grand prizes for today, including a Sleep Suit bag by Ergo Pouch Australia, a $100 e-gift card to primary.com, an OXO Bath Time collection, an OXO Tot Sprout high chair, and finally, a Lux Tour Plus stroller from Zoe Stroller. So these prizes are going to be shipped directly to the winners, which consist of you participants who are logged on right now. And we'll randomly pick a winner and choose them in real time after each presenter. So stay tuned and good luck. Without further ado, I'm very excited to share our 2020 panelists with you today. We are an all-women's panelist for this year's event. Our local health experts will share the most up-to-date information in their field related to their topic of choice. And I know you're not going to only find it interesting, but it's also going to be very useful to you. Each speaker's topic also addresses a different life stage, going from preconception up to early childhood, as we recognize that our attendees are from all different stages of early parenthood and childhood. So I introduce to you today Dr. Linda Sung, hey, Division Director of Reproductive Endocrinology and Infertility at NYU Winthrop. She's going to speak on the topic of how to optimize your chances of getting pregnant now or in the future. We also have Rachel. Rachel, give a wave. Rachel Parotta. She is a pelvic health physical therapist at Parotta Physical Therapy in Huntington, New York. Her topic today is your body in pregnancy, the core, and the pelvic floor. We also have Andrea Orbon. Give a wave. She's a pediatric nurse practitioner and international board lactation consultant at Cohen Children's Northwell Health General Pediatrics in Garden City. She will be speaking on the topic of confident breastfeeding, your attitude and ability to confidently nourish your baby. I myself, Eleana Kaidanian, I'm a registered dietitian. I practice in Long Island for my own business called Long Island Nutritionist. And I'm going to be speaking on the topic of your role in the development of healthy eating behaviors in your children. And lastly, we have Dr. Sheila Omrani. Hi. She's a pediatrician at Kings Point Pediatrics in Great Neck, New York. And her topic today is summer safety. And with that, I give you our first presenter, Dr. Linda Sung. Go ahead, Dr. Sung. Unmute yourself, please. There you go.
Thanks, Eleana. Okay, so today's topic is how to optimize your chances for getting pregnant now and or in the future. And I think that the first thing to start off with is how old are you today? And one of the things that I always like to recommend for everybody is what I've coined the egg check test, which is checking cycle day 3, meaning Day 1 is the full flow. 2 days later would be a cycle day 3. FSH, follicular stimulating hormone, estradiol, anti-Mullerian hormone, which is AMH, and a sonogram. And by doing this quick test, either with your OBGYN or with a fertility specialist, you can get a snapshot look at where your egg reserve is today. Unfortunately, we don't have any tests that say, okay, you're going to go through menopause at this point, your eggs are going to age rapidly at this point, but this gives you a snapshot. Everybody ages differently. Everybody reproductively ages differently. This is a great test to do. If you are 35 years or older, do this test. Take a snapshot look. If you're thinking and you're under and you're thinking, you know, I'm going to get pregnant someday, how do I look like now? How do I look like later on? You can do this test. If you're under 35 and you have these medical conditions here or surgeries that have potentially affected your ovaries and potentially affecting your fertility, then you should do the egg check test. We're going to talk about these other topics in the next slides. For immunizations, immunizations are easy to do. And I tell everybody, if you're going to get pregnant one day, check your immunizations now. Make sure you're updated on all these vaccinations. We do need a repeat MMR from childhood vaccinations as an adult, and it's a single dose. And anything that's asterisk here is a live attenuated viruses. These live attenuated virus vaccinations require at least 1 month to wait before you try and get pregnant. And these are really important because these particular types of diseases can potentially affect the unborn baby in a pregnant woman and can be completely prevented by taking vaccinations. In fact, just back in February, we had a measles epidemic, and a lot of women did not have vaccinations, and you can actually get them and not worry about having your unborn baby affected. The flu shot is a recombinant vaccination. It can be given anytime, even in pregnancy. Infections. So I think the hot topic for infections is COVID, but we're going to first talk about simple things. Like if you have a cat in your house, especially if the cat is an outdoor cat or historically an outdoor cat, get a toxoplasmosis titer checked on yourself. See if you're immune or not. If you're immune, you don't have to worry about changing the cat litter box. If you're not immune, then once you're pregnant or thinking about getting pregnant, have someone else in the household change the cat litter box because you can get toxoplasmosis, which is a parasite that's infected from the cat feces. Zika travel. Now that was a big topic about 2 years ago, and anybody that went to a country that was in the equatorial region could potentially catch Zika from getting bitten from an infected mosquito. Now we don't hear about it very much, and people think that it's no longer around, but actually it is. The difference is that people that live in those equatorial regions have already been bitten by mosquitoes, have developed antibodies, and are no longer having the potential of having a baby infected with Zika and getting subsequent microcephaly. Micro meaning small, cephaly means brain. And once the infection occurs in the baby, there is no treatment, there is no vaccination. And what ends up happening is you're pregnant, you're looking at an ultrasound, and we're watching the brain not growing until birth, and there's nothing we can do about it. So the best thing is prevention. If you are thinking you're going to get pregnant and you really have to go to a foreign country, then wait at least 3 months upon return if you're going with a male partner. If you're going by yourself, just as a female, you can wait 2 months. It has been shown that sperm lingers, that at least Zika lingers in sperm for 3 months, so 3 months upon return. Other viruses to check and see what your status is, parvo, cytomegalo, especially for school teachers, because those infections tend to always go around in the schools and people tend to get exposed to them. And if you know you're not immune to these infections, you can always tell the school nurse, and if those infections arise in the school, they can just tell you so you can take extra precautions to hopefully prevent yourselves from getting these infections. COVID-19, the coronavirus, that's the biggest topic of all. It has changed the way we practice medicine. It has changed the fact that we're doing virtual event for Eleana as opposed to a live event. And the most important thing to remember about COVID-19 and pregnancy is that time will tell. This is very frustrating. We don't have very much data on this, So the only thing we can do is prevention. And doing this event virtually is a smart move. It protects all of you. You get the education, you get the gifts. I think it's phenomenal. So thank you, Eleana. And the other thing we have to remember is that COVID-19, what information we have really comes from China. It actually started as an epidemic in Wuhan, China in December 2019. And the women that were infected in the third trimester delivered January, February, and March. What do we see from that? Higher incidence of fetal death, stillbirths, maternal deaths. Women that were infected in the second trimester are delivering now, April, May, and June. What are we seeing? Intrauterine growth retardation, meaning that the baby is measuring small than it should because it's not growing well as stillbirths, fetal deaths, maternal deaths. What about people infected in the first trimester? Well, they're going to be delivering July, August, September, October. Time will tell. We don't know what's going to happen to those infections that occur in the first trimester. And I'm a little bit worried about it because, as you all remember, first trimester is when the brain, spinal cord, heart, liver, lung parts of the baby are just forming. So take your precautions. It is super important for the safety of your pregnancy. Other things that people can do now and saying, you know, I'm going to get pregnant one day, now as well as you are trying to get pregnant, is diet and exercise. Taking folic acid, 1,000 micrograms daily. Studies show that if you start at 3 months before you get pregnant, there's a dramatic decrease in neurotube defects. What are neurotubes? Things that form the brain and the spinal cord in the future baby. Easy to do. You can buy it over the counter, easy to access. Prenatal vitamins. You can get those over the counter. If you do get a prescription, the prescription prenatals have that folic acid of 1,000 micrograms. If you do over the counter, just supplement with an over the counter folic acid as well. DHA, fish oil. Again, easy to access, good to have. Low mercury foods. You can Google to see which foods have low mercury. One of the highest mercury foods is tuna. I had a patient who ate tuna throughout her whole life. Her levels were so high she had to be chelated. Once you ingest mercury into your system, it stays there for years, and it's not an easy thing to metabolize and remove from the body. Low mercury fishes are salmon and tilapia, but like I said, you can Google those. Avoid foods that potentially can be contaminated with listeria. So those are commonly delicatessen type foods. Make sure that they're handling the foods well, that the refrigeration is adequate in wherever you're buying it from. Vitamin A toxicity. So sometimes I see women been on multivitamins, and then they're thinking about getting pregnant. They add the prenatal in. More is not better. Having both multivitamins and prenatals is too much. Vitamin A toxicity, and that can cause problems with the fetal development, the baby development. Check your vitamin D. You can do that with your primary care. You can do that with your OBGYN. Easy to do. Especially when you're coming from the winter months. The sun is the major source of vitamin D, and it's an easy supplementation. That has been shown to increase infertility and also affect the baby development, and it's an easy thing to supplement. A great thing, 30 minutes of cardiovascular exercise, 3 to 5 days a week. Weight Watchers is always a good thing to do before you're getting pregnant if you want to lose weight, healthy, avoiding sweets, and trying to focus more on low carb, high protein, high vegetables, high fiber diets. Since this COVID epidemic has occurred, we've had a lot of people at home, and I think there are thousands of apps out there now on self-care, yoga, meditation, Pilates, running. There's tons of exercise apps that you can access. Other lifestyle habits are less caffeine. How much is too much coffee? Remember, caffeine is coffee, tea, cooked products, all of that. 1 or 2 cups a day, and a cup is 8 ounces. So 8 to 16 ounces cup a day is fine even when pregnant. Some people switch to decaf. I'm always a little concerned about decaf in pregnancy because it has more chemicals than just caffeine. If you drink an 8-ounce cup a day when you're pregnant, I think you'll probably be okay. No smoking, period. No smoking, period. Smoking will actually age the eggs and decrease their quality as well, and it is irreversible. Studies have shown that women who smoke will get an earlier menopause by 2 or 3 years. So you're definitely affecting your ability to get pregnant in the future. Just don't smoke. If you are overweight or obese and losing 5% of whatever your present weight is will, prior to getting pregnant, will decrease preeclampsia, gestational diabetes, C-section, infertility, miscarriage, birth defects, preterm delivery, and thromboembolic events. Always best to do it healthy, eating healthy, exercising, rather than taking diet pills, which are sometimes quite dangerous, especially to the heart system. No drugs, of course. Endocrine disruptors. Those are chemicals that are found everywhere, and they can cause problems with your hormone systems, creating infertility, miscarriage, birth defects, and cancers. So easy things to do is avoiding plastics that have BPA. Store your foods in glass containers, not plastics. Avoid phthalates and parabens. Makeups and fragrance products have tons of phthalates and parabens. Try and shoot for clean beauty products. Sunscreen. Use non-nanotitanium and zinc oxide. Avoid pesticides, lead paste, and asbestos, and certain work sectors will actually have increased risks. Genetic screening tests. Now, there's all this stuff out there about ancestry DNA, 23andMe, and I've seen patients do that. And if you are interested to see if you carry any genes that could be genetically transmitted to your child, I would highly recommend that you go see your doctors and get tested with them. The most important thing is that you get the counseling on how to deal with the results. You understand what you have and what you can do to prevent things from happening. I had one gentleman come with me with his fiance, and they came because she was over 35 and she wanted to do her age-check test. And he had tested positive for BRCA through the 23andMe test, and he had breast cancer in his family. And he disclosed that when they were starting to date, and they'd met through eHarmony or something. And he said, she even said yes to me, even knowing that there's a 50% chance our children will have this BRCA gene, and had no idea that by seeing somebody like me, he could actually prevent them from having a child that has the disease by doing IVF, because we can genetically test the eggs that are fertilized by the sperm prior to transferring it, prior to them getting pregnant with that child. So there are apps for everything now, and I encourage people to use them. You can do period tracking, you can time your ovulation, and they work really well if you have regular periods. Nutrition calorie trackers are excellent. Health sections in your phone, exercise apps, and the latest thing that we're doing now is telemedicine consults. I think that's a type of medicine that's here to stay. It provides people the opportunity to get counseling, to understand what's going on with them at a safe distance and still get adequate treatment. Any questions?
So the attendees type in a question for you. And if anyone doesn't have a question right at this moment, we can also reach out to Dr. Sung via email later on. I can reach out to her with your questions. But does anyone have any questions right now that Dr. Sung can answer in real time? Please, we'd love to hear from you. Okay, well, thank you so much, Dr. Sung. It's always a pleasure. I learned so much from the speakers, learning so much from you. And I really appreciate your time. Thank you so much.
Thank you, Eleana. Have a good day.
You too. Okay, so we're going to continue with our first prize giveaway. So who's ready? Everybody who's in the webinar right now, your name has been entered into our gift bag. Our first prize giveaway of the day is an award-winning Sleep Soothe bag by Ergo Pouch. You get to choose the color and the size of your choice, which is really great. The company is going to send the prize directly to the winner, shipped to you. I have all your email addresses, so don't worry about me reaching out to you if you want. Just enjoy it. This item is also really cool because it converts from a sleeping bag to a sleep suit with legs with a 4-way zipper, and it's made from super soft, organic, breathable cotton. Okay, and the winner is, can you see that? Dina, congratulations. Dina Mustafa, you just won. So we'll reach out to you, and without further ado, I give you Rachel Parotta. Please unmute yourself and introduce yourself.
Hi, good afternoon. I'm Rachel Parotta. I'm a pelvic health physical therapist here on Long Island, and I'll be talking today briefly about changes to the core and the pelvic floor muscles in pregnancy and how you can safely perform some exercises to prepare for birth and the postpartum period. And I always tell my clients to check in with their OBs or their midwives and make sure that they are cleared to continue exercising in pregnancy, and if there's any precautions or anything we should know about their ability to exercise. So we'll start with the abdominal muscles. There are the rectus abdominis, otherwise known as the six-pack muscles for some folks. These muscles, to make room for the baby, they start to widen away from each other. This is called diastasis recti abdominis, and this has become a hot topic in postpartum fitness. But we want people to know that this occurs, we think, in 100% of pregnancies by week 35. So some people would like you to think that you can prevent this, or this happens only if you do the wrong exercise, but we think this is a natural accommodation of pregnancy to make room for the baby. What we do want to try as physical therapists is to limit exacerbating or putting too much pressure through the center tissue here when the muscles are widening, because some people postpartum struggle with closing the abdominal wall back and getting good tension in their abdominal muscles. So some exercises we find increase pressure through this center spot and should be modified in pregnancy. Some of those exercises can include sit-ups, leg lifts, pull-ups, or planks or push-ups, depending on the person's abdominal wall. So some modifications that I have my clients do to put less pressure through that center line can include lying on a wedge, especially earlier in pregnancy. If you want to continue to do some traditional abdominal exercises, lying semi-recline can make the movement smaller and decrease pressure coming through the center. Doing abdominal exercise on hands and knees rather than in a full plank position can also decrease pressure and load on the abdominal wall. Or if you want to still do your planks and push-ups, we find that bringing them up into an elevated position also decreases bulging in the abdominal wall. And that can include, if anyone out there is doing some burpees or some harder exercises, converting them to doing them onto a higher surface can be advisable. Another muscle I think about often is this deep abdominal muscle. It's called the transversus abdominis. It forms like a corset in your abdomen. And this muscle gets very long as the baby grows, so it doesn't separate. This gets long and long and long. So a lot of people feel a lot of weakness in this, what they call deep core muscle after birth. But the good news is that it's safe to keep exercising this muscle in pregnancy, and it's simple to do. So we ask people to just pull in the baby or pull up and in the baby, hold for a moment, and let it out. Okay, we always tell people to not hold their breath while exercising, which can be a little challenging when you're first learning an exercise. So we ask people to breathe in, breathe out. You can pull the baby in, breathe, let the baby out. And you can do this in sitting, standing, or hands and knees. You can also integrate pulling the baby in gently to use this muscle while you're doing other exercises to keep in touch with your core muscles during pregnancy. So if you're doing some other kind of exercise, like lifting weights, you can coordinate pulling the belly in, letting it out while you exercise. We're going to talk about the pelvic floor now. So we're moving from the abdominals to the bottom of the pelvis. So for me as a pelvic floor specialist, this is where I treat clients often, but it's, for many people, it's an unknown area of their body, or we don't think about having muscles in this region. So we're looking at the bottom of someone's pelvis if they were lying on a table. We have 16 different pelvic floor muscles. They have 3 functions. They're sphincteric, so they hold in urine and bowel movements. They lend support to the pelvic organs like the uterus and the bladder, and they have a sexual function as well. During pregnancy, whether you have a cesarean birth or a vaginal birth, these muscles are accommodating or changing, meeting the demands of having a pregnancy. So many clients think if they have a cesarean, they don't necessarily have to think about the pelvic floor, but these muscles have been involved the whole time. In vaginal birth, they do undergo a large, quick stretch. The muscles come back and recover with time and rest, but they often feel weak postpartum. The muscles have to do two things in terms of their function. They have to contract, but they also have to let go. So oftentimes in our culture, people just talk about the contractions, which is known as a Kegel. So that's like the squeeze that you do when you're holding urine or holding back a bowel movement or gas. But the relaxation part is just as important. So this allows for urination, bowel movements, but also in birth, I tell clients to try to keep this area soft and open when they're pushing out their baby. So we can try together. We want to make it interactive, so no one has to get undressed, but while we're sitting here, we're going to try to do the contraction and the relaxation together, okay? So if everyone, the cueing can sound a little bit funny, but we find it works well for people. If you think about lifting up a blueberry with either the vaginal opening or the anal sphincter, so if you feel ready to try, you can see if you can close around an imaginary blueberry and lift it up and then put it back down. We'll try one more time. Try to lift the blueberry, keep breathing, maybe hold the blueberry for 2 more seconds, keep breathing, and lower it back down. So again, many people are familiar with the Kegel part, but I also talk about, can you feel the release? Okay, we always say with the pelvic floor, what comes up must come down. And again, during pushing of birth, if someone's asked you to push, we want you to keep the pelvic floor relaxed. I have some people who think the pelvic floor has to squeeze to deliver the baby, but it's your uterus doing most of the pushing and you're helping maybe with the abdominals, and this area stays relaxed and open. So oftentimes women in pregnancy come into me and they say, oh, I've been doing 1,000,000 Kegels, or I feel bad that I haven't been doing 1,000,000 Kegels. We often don't need to be doing too many tens of hundreds of sets of pelvic floor exercises if you're not having symptoms in pregnancy, especially towards the end, because we want the muscles to stay soft for the birth. So I tell my clients I can assess their pelvic floor late in pregnancy if they're seeing me, but I tell them no more than 10 Kegels a day if they're not having symptoms, and I want them to really focus on the relaxation part of their Kegel and see if they can practice, if they're doing a fake little push, if someone asks them to push in birth, so they feel like they can keep this area open for birth and not squeezed. So again, as a pelvic health physical therapist, I assess clients in pregnancy and postpartum. I help with exercise modification, preparing for birth, and recovering postpartum, especially the pelvic floor and the core muscles, as well as addressing any pain or incontinence or muscle weakness in the pregnancy or after the birth. Thank you.
Thank you so much, Rachel. That was really informative and wonderful. I always had questions about the Kegels and the diastasis recti, so thank you so much for that. Any questions that Rachel can answer for us in real time, please type them up in the chat box, and if you think about it later, you can also reach out to us. Thank you again so much, Rachel. Okay, so let's go to our next prize giveaway. We have a $100 e-gift card or voucher to primary.com. They're an online sustainable clothing brand that makes timeless unisex styles. So they don't actually have girl or boy, it's all mixed together. They have from size newborn to 12 years, and they use premium fabrics at an affordable price that's really meant to last in between siblings and even hand-me-downs. So when you invest in primary, you know that you're investing in good quality. So I see that we have a question. I'm just going to pick the prize winner, and then Rachel, I'm going to hand over the question to you, okay? Okay, and the winner is Rochelle Ocampo. Hope I said your name correctly. Congratulations. We'll email you your prize. So let me get back to the question for Rachel, and it's, can you please address peeing when you sneeze during and after pregnancy? There you go. So unmute yourself.
Sure. So having what we call stress incontinence, which is leaking urine with coughing, laughing, sneezing, is pretty common in pregnancy because there's a lot of pressure coming from above the pelvic floor and the sphincters that hold back the urine. So I teach my clients to try to Kegel before they sneeze if possible in pregnancy. Also, a little tip is like the more you let out the sneeze, kind of the pressure has to go somewhere, and if it comes out more, then like down, that's for postpartum too. So like the messier the sneeze, sometimes the less pressure, and it makes it easier to hold back. But I'm not too concerned. It's not for me indicative of you having a problem postpartum if you're having leaking with sneezing in pregnancy. It's just tough with the baby and the pressure. And then postpartum, I would assess someone for muscle weakness or if there's any scar tissue that's preventing the pelvic floor from closing tightly when they sneeze. And then we would do muscle retraining exercises to try to meet the demands of the sneeze postpartum. I hope that's helpful.
Definitely. Thank you so much. Do we have any other questions before we move on to our next speaker? Okay, if not, then we're going to continue. And I introduce to you our next speaker, Andrea Orbon. Andrea, you have the floor.
Hi, everybody. Welcome. Again, I just want to thank Eleana for doing a great job putting together this webinar. Very informative. I'm enjoying it myself. As we all know, breastfeeding has always been the first choice for nourishment of our newborns. However, sometimes it can be difficult for some more than others, especially now with this unfortunate pandemic we've all had to endure. Many changes have been implemented, and there's been a lot of lack of access to educational resources, and the whole birthing process has changed dramatically, causing a lot of anxiety. So we decided today we'd focus more on how to be a confident breastfeeder and the effects of the pandemic on mothers and some tips, you know, positive and negative as well. So basically, breastfeeding, as you know, is just a beautiful experience and a special bond between mother and your child. And the main things I try and tell my parents when they come into my office, it requires patience and time. It's not something that can be rushed, and it's not something you're born to be able to do. Some people are luckier than others. Don't be so hard on yourself, okay? You need the support of your spouse and your family. A lot of times, fathers will come in and insist the wife does it when they really don't want to, or vice versa. So, you know, have some confidence in yourself as well. And you also need educational support. You need some prep time before you deliver, or reach out to, you know, whether it be a lactation consultant or speak to your doctor, or maybe friends that have breastfed also. There are some cardinal rules to being a successful breastfeeder, I call it. First, obviously, we've all been told many times, allow for that skin-to-skin contact and attempt breastfeeding immediately after birth. Most babies will root and be able to latch, even if it's just for a few seconds. A lot of mothers get frustrated. That's the first thing they tell me. Babies are very sleepy in the beginning, and that's normal, especially the first 2 weeks, and that's okay. There's a lot of stimulation techniques you can be taught, which anybody can show you if you do in-person or a telehealth visit. Know that you're not a bad mom if your newborn doesn't latch right away. A lot of mothers are crying right away and want to give up immediately. It's okay. Babies take time to latch. Some of us don't have nice protruding nipples. They're flat, and there's a lot of things we can do to help you so that the baby does latch. Trust yourself. Don't give up right away. Don't give in to a bottle because your husband or your mother-in-law or somebody's telling you, oh, you're starving the baby. It's okay. You can feed the baby sometimes with a syringe. And sometimes people are able to do both. They breastfed bottle if needed. You know, it doesn't always happen that we have a lot of breast milk ourselves. Some are luckier than others. Pumping is not always a telltale sign of how much you can pump, because the baby's latch is able to really express more milk. So you have to trust yourself and that your ability to nourish your baby. And when else fails, seek lactation consultant help in the hospital. If that's not available right away, then the minute you get out, normally most mothers do have to follow up in 24 to 48 hours with their pediatrician. And there can be a lactation consultant in the office, or you can also, given a list when you're discharged, you can contact them. Some lactation consultants will also visit you in the hospital as well. That leads to being informed. Prepare yourself before delivery. If this is something you know you really want to do, then maybe look up some internet information, read some books on breastfeeding, consult a lactation specialist ahead of time so she can note maybe some of the issues that you might encounter if you have flat nipples and the things to have. I recommend all my moms, if they come in for a consult when they're interviewing for pediatricians, to have all your breastfeeding supplies available to you at the hospital as well as at home. It'll decrease a tremendous amount of stress when you're discharged. So simple things like a nursing bra, a top, especially if you come into our office. A lot of moms come in and they don't even have that on, and it makes it more difficult for them. Breast pump, I would definitely have in your home. If you don't have one like Medela or any of those, then you can also rent one from a surgical supply company. And those are hospital grade, which work very well, and they're not very costly. A lot of insurances will also cover them. The boppy, the pillow, it's very important to have a pillow. If you don't have a boppy, make sure you have access to pillows. Nipple shields are good and can be given to you, especially for flat nipples. Or preemies need them. It helps keep the baby awake better and an easier latch, or if your nipples are cracked and bleeding. So those are a good thing. You don't have to have a lot, even just one or two. And maybe some lactation consultant numbers if your office doesn't have one available to you. If you can get an office that has a lactation consultant, it's definitely a home run because it's more access readily available to you, less cost because that's part of your visit. And I think it makes your life a lot easier. Okay, important. Again, we talked about it in the previous slide. Trust yourself. Have confidence. Know that we're the only ones. Our husbands can't do this part. We have milk. We can nourish our baby. It's not always about how many ounces. I need to know. That's not important, okay? Breastfeeding on demand. Your baby will cue you when they're hungry. Length of time is important, though. You can't do, a lot of mothers come in and they'll be like, well, he latched for 2 minutes, and I thought that was good, but that's not true because you have to get to the fatty part of the milk. So we really, besides saying on demand, you should be doing at least 15 minutes burping between breasts, but on both sides, so both breasts evenly produce. Just as if you were to pump, you have to pump both sides as well. Especially in the beginning, too, you can't just skip breastfeeding. You can just say, well, you know what? I don't feel like breastfeeding at night. I'm tired. It's very important for your breast to keep producing. So if you're going to skip one feed, then you need to pump. If you start decreasing that, then what will happen is your breasts adjust and they'll decrease milk as well. So this is very, very important to know. Anything that you pump, you can always freeze and use it at a later time in case you have decreased milk supply. Signs of adequate hydration, which is all you need to know as a mom, is that the baby's wetting diapers, okay, at 6 to 8 usually is around the average. And babies, especially the first month, once your milk flow is in, they'll have a lot of multiple yellow seedy stools. They can have 10 to 12 a day, which is normal. And that's because there's high protein in breast milk in the first month. And that's a difference between bottle fed and breastfed, is that you'll definitely have a lot more stools. Weight gain also, you're going to follow up with your pediatrician upon discharge, and usually about a week after that, just to ensure that the baby is picking up weight, because normally in the hospital they lose, ounces, which is normal. So the goal is to have about an ounce a day is the standard weight gain, and those are the 3 telltale signs you look for when a baby is getting adequate hydration. If you ever have any doubt, or if the baby's jaundiced or something else, some pediatricians will tell you to piggyback a little extra formula just to make sure the baby's getting hydrated, because normally your milk will not come in until approximately day 4 after your delivery. So you can always add extra formula on top of after nursing, and you can give that via syringe and things like that as well. And most important, newborns should be examined 1 to 2 days post-discharge. That's very, very important. Now, unfortunately, COVID has made a dramatic impact on the mothers, negative and positive. I'm going to just go over the negatives first to look forward to the positives. I know it's been a very stressful time for everyone. A lot of access to information has been canceled, such as prenatal classes, breastfeeding classes, even some in-person visits. A big difference, earlier discharge. Some mothers are being discharged as early as 12 hours post-delivery, up to 24. And a lot of mothers are being relocated to different sites once they deliver. They're going to like one-day surgery buildings and then discharge from there. So that's been a very big difference. Husbands have not been allowed in the delivery, or family to present during it, or to visit in the hospital as well, which has been left mothers very depressed, increased anxiety, feeling alone, which is understandable, but it's just to protect everyone. A lot of mothers, even I've had a lot of moms coming in who have been COVID positive. They're all being swabbed when they come in, but they're asymptomatic, as well as their husband. So it's been a very, questionable, a lot of unsure answers with this whole disease. Babies have been so far negative, and we are retesting them, swabbing them in our office approximately 14 days post-delivery as well. And so far, most of the ones I have seen have all been negative. There's been lack of breastfeeding support in the hospital, just a lack of personnel and relocation of the patients, as well as consultation. A lot has been telehealth, and breastfeeding can be done telehealth, but sometimes people need that in-person, that first visit in person, which if you have them in the office, that's helpful. Now, some positive effects: moms and dads have been able to be at home together. Most people are working from home. They haven't had to leave each other. They've had extended stay at home, which is a nice thing, and they've got to enjoy their baby and get to know them. Even though people, yes, love to have family come, it's actually a blessing to have less visitors at first, because it does allow you that private time, that less stress from in-laws or mothers telling you, giving the kids cereal early and all this kind of stuff that they usually do. Moms have the time to bond with their babies and improve their success with breastfeeding and give them that time that they need, okay, which is a great thing. Most importantly, I just want to stress, breastfeeding during times like this is critical, because a lot of parents have not been able to even access formula. It's been difficult. I've had to give samples from our office if needed. It's been a real stress upon parents. So at least if you're breastfeeding and you have the milk supply, that's one thing you never have to worry about. You might have to worry about diapers and getting toilet paper, but at least the milk is there for the babies, which is great. And just a couple of little words of advice. I just try and, to enjoy your baby. You have to enjoy this time. This is a beautiful moment for you. It shouldn't be. Unfortunately, we can't control our hormones, which are normal, and we'll cry and we'll get stressed. But allow yourself the time, at least 2 weeks, to adapt to breastfeeding. It's something you'll never have that chance to do again if you don't have another baby. Get to know your baby's nonverbal cues that indicate they're tired, they're hungry, when they want to just be held, or if they have gas. And this is being home with them for the first 3 weeks critical anyway. You get to know them. You're going to be the expert. No one else can tell you what your baby needs but yourself. And this will prove you have self-confidence, you trust yourself, and you'll feel like the best mother ever. But I just stress that. Give yourself the patience and time for this. Don't be so hard on yourself. Anybody have any questions?
Thank you so much, Andrea. That was so good. We had a lactation consultant at almost every event, because it's so critical to know how to feed your baby. It's almost crazy that you can leave the hospital and then once you get home realize, oh, I'm not really sure what I'm doing, or if what I'm doing is right. And many people often, when they go for their pediatrician visit, then they realize, oh, I need to really see a lactation consultant. My baby might not be gaining as much, or not have it, maybe dehydrated. So even so, having a lactation consultant speak at most of our events, we always learn so much, and we really appreciate your time, especially relevant to what's currently going on. Any questions for Andrea? Okay.
Andrea, I have a question.
Mm-hmm.
From what I understand and everything I've looked at, I don't see that there is transmission of COVID-19 in breast milk. So I've been highly encouraged.
So good, there hasn't been it. So I am stressing to moms, just for that benefit alone, it's so important to provide the antibodies that you have, and that's why we always recommend breastfeeding, especially for their immune system and development. If mom is COVID positive, she could still breastfeed. I recommend wearing a mask, and just good hand washing. You know, I know a lot of people, you know, are getting a little bit paranoid. It's understandable, but it's just the old time. Just like we tell any infant born, less than 3 months, they shouldn't be out in stores, you know, just a normal thing. And it's just good hand washing and wearing a mask. And I strongly, strongly recommend breastfeeding because of this.
Right. And are you guys providing telehealth medicine so that they can be at their home and be counseled by you guys?
Yes, we're doing well visits. We do well visits in person, and we do them telehealth. We also do breast lactation consulting via telehealth. And, you know, the good thing, knock on wood, most of our office has been mostly well because we're trying to keep the kids up to date with shots and stuff. So a lot of parents still want to come in for that first 1 or 2 visits, especially if they need bloods or checks for Billy. We do have the Billy, the test for Billy in our office, so we don't have to send them for blood work, which is a good thing. So most are coming in the beginning, the first week, but the rest we're doing mostly telehealth is accessible for well and for breastfeeding.
Exactly. I think the overall medical approach has been minimize the in-office visits and communicate and educate as much as possible. That was excellent. Thanks, Andrea.
Oh, great. Thank you.
Yes, thank you so much. Okay, let's go to our next prize. We're giving away an OXO bath time collection. It includes several pieces, so it's not something that you could buy all together. We actually just collaborated and put some of their best products into one. We have the Splash and Store bathtub, stand-up bath toy bin. I actually have this, and I'm still using it. My oldest is almost 6. Tub stopper and a potty chair. So this is the ultimate bath bundle of products. It's user-friendly, clutter-free, multifunctioning, really easy to clean and wipe down. And all of these products are meant for extended usage. Like I said, I'm still using a lot of the products. So without further ado, the winner is Maria Santini. Hope I said your name correctly. Congratulations. You are the winner of this great prize. Okay, so now it's actually my turn. Don't mind me if I turn my video off. I can't be distracted by myself. So today, like I said, if you logged on a little late, I'm a registered dietitian. I practice in Long Island. My name is Eleana Kaidanian, and I'm going to be speaking on your role in the development of healthy eating behavior in your children. So I speak every year at my own events, why not, right? And I really had to think of what I was going to speak about this time because many of you come back to my events each year and I don't want to bore you. And I also want it to be up to date. So last week I was actually reading a research article that said nearly 1 in 5 US kids are obese, according to the latest data from the CDC. Well, we've been hearing this for more than a decade, so that's not new. The title wasn't shocking. But at the same time, it is because as a country, we've also been actively trying to reduce childhood obesity. And now, because of this pandemic, we might even see worse trends in the coming years. So that is really upsetting. Obesity is not merely overweight, but it's a level of serious excess weight that the reason why we measure it is because it can actually predict or show risk factors for additional worrisome diseases in the future, like diabetes, comorbidities like heart disease. So while there are many factors that contribute to childhood obesity, the most common ones include eating a lot of processed foods, drinking sugary beverages, and of course, lack or not enough of physical exercise. But today, I'm actually going to focus on your role as a caregiver because you know, whether you have a newborn at home or an older child, you're home with them. They're not going to school. There's no after-school activities. There's nothing going on the weekend as far as organized sports, or they're home with you. So you are basically in control of basically mitigating their obesity risk and just, of course, overall health risk for their future. So why you might think that I'm jumping the gun because, again, this is more of a pregnancy baby event, but your ability to manipulate or have control over your child's eating behavior can start from the moment you start bottle feeding or as soon as you start introducing solids. So this slide is really focusing on the parent's role in nurturing positive eating habits from birth. So as Andrea Orbon mentioned just before, this is the time that you bond with your infant, and this is the time that you're going to learn their distinct hunger and satiety cues. You're going to learn as a mom or as a dad or as the main caregiver which cry means that your baby is hungry, which cry means that they're having stomach pain. You're going to learn these sounds, and only you as the parent or the caregiver really get to decipher or decode these signals. So it's important to respect these signals from your baby and respond appropriately. So stay neutral, calm, and responsive. That's what I mean by that. You want to, of course, have some control in the feeding when you respond to these cues of hunger, whether you're feeding at the breast or at the bottle. It's your job to offer the nourishment, but we need to let go of some of that control and let your baby end the feeding. So you start the feeding, the baby should end the feeding. We're all born with an internal regulator that signals when we're full and to stop eating. You might have some doubts, you know, your baby is a newborn, what do they know? You're the parent, you know everything, you know more, you know what's best for your baby. But really, babies are really good at knowing when they're full. Parents and caregivers tend to manipulate this natural process very early on after birth when they introduce a bottle. It happens less if you're feeding at the breast, because when you feed at the breast, it requires a lot more work for the baby. They have to actively suck, as opposed to when you offer a bottle, even if you're putting breast milk in the bottle or formula, whatever it is, the bottle mechanism, the way it works is that it's a response going from gravity, there's a drip. Even if you hold the bottle upside down, you'll see it's dripping out without any sucking, without anything pulling it, just from gravity, it'll drip, especially depending on the size of the nipple hole. So what I'm trying to address here is that it might feel really good to see your baby finish the bottle. It might say, oh, there's 1 more ounce left, and it was so hard for me to buy this formula, and I really want my baby to keep growing and gaining weight. Everybody likes to see a nice, plump, chubby baby. They're so cute, and there's just a few more drops left. Let me try to finish the bottle, and you'll offer the bottle again, even though the baby already turned its head away, or, you know, most newborns can't really push the bottle away, but usually they turn their head to indicate that they're full. And when you offer that bottle again, just to finish a couple more ounces, a couple more drops, this encouragement is actually what's manipulating the baby's natural internal cues for feeling full. So we don't really want to do that, especially from an early age, because this is an ongoing struggle that stays with you into adulthood when people overeat. Okay, so now we're going to progress from birth to starting solids and into preschool age, how your role can impact your child's eating behavior. So as your infant grows, and we said we want to let your child self-regulate, it's your responsibility to choose what they eat as a parent, but it's the child or infant's or toddler's responsibility to choose how much, or if any at all. You know, maybe your baby or your child doesn't want to eat anything at that time. You can't force it. You have to respect it. It might not be ideal, you know, like you want to leave the house, you have things to do. Maybe not so much now because of the pandemic, but that's where a lot of the struggle comes, is because, you know, it might not be an opportune time for your child to eat when you're in the car or going somewhere and they're hungry and they start crying. And of course, you would never feed in the car. But what I'm trying to say is a lot of the struggle comes when we try to make a schedule. And while it is very important to have a schedule, sometimes your child doesn't want to eat, and that can cause a back and forth between the parents and the child relationship. So as your kid grows into preschool age and beyond, it's really important to remember that meals are an important time, not just for eating, but for conversation, and to look at one meal at a time. Trust that your child is going to balance the food, their nourishment, over a week's time. don't stress too much about that specific moment when they're eating, that they're not eating a vegetable or they're not having a fruit or they're not getting the nutrients they need in that moment. Again, part of the do is keep a variety of foods on the table, mix and match foods so that they get nutrients that they need from all different types of foods. And one of the most important things that you can do as a caregiver, as a parent, is modeling. So let your child see what you're eating. Eat with your children. Let them see how you eat with your hands or with your utensils. Let your child see, touch, play with the food, and finally, maybe they're going to even taste the food without any pressure from you. And if your child refuses to eat at mealtime, it's dinner time, we're all eating together, and they say, I'm not hungry, or they're not able to say, but they're just looking at you, it's okay. Let them join you at the table anyway. Don't force them to eat. But that mealtime is just so important for so many other reasons, to nourish a healthy relationship with food, and just to be together. So really, unless your pediatrician is concerned about your child's growth, try not to let mealtime be a stressful time. And this is really going to stay with your child as they grow. Okay, so now we're getting ready for the don'ts. So I did the opposite of Andrea. She started with the negatives and ended with the positives. I'm doing the opposite. But while there's some serious cases of severe pickiness in some children that can actually result in eating problems, most of the time, generally speaking, picky eating is actually very normal and totally okay. Okay, I know it's not so okay for the parents and they feel like it's a very stressful time, but generally speaking, it's very normal and appropriate. So you might see food jags, which are favoring certain types of foods. Like you might notice your kid all of a sudden really likes starchy foods and not really accepting protein foods, or they go through different stages. You might even see it in your 8-month-old or your 1-year-old when they're trying different foods. They might really love yogurt. They're eating yogurt every single day, yogurt, and then one day, nope, they don't want it anymore, and that's it. That happened with my daughter. She's almost 6 now, and ate avocado almost every day when she was a toddler. She hasn't had avocado since that time period in her life, and she just won't, and that's that. But there are plenty of other foods that have healthy fats that I can encourage for her, so it's really not a big deal. And I'm sure as time goes, when she's ready, if she wants to try it, she will have it, and if she likes it, it will be part of her diet. So that's what I'm trying to convey here. If your child is severely selective with a food choice, or if you're really worrying that they're not growing well or not getting the nutrients that they need, that's what we're here for. I wouldn't have a job otherwise. That's the time to speak with your pediatricians, speak with a dietitian. Most of the cases I see of parents coming to me about picky eating in their children or just negative eating behaviors, most of the time they're being a little over worried, and from my experience with them, most of the time the situation is actually really fine, and I basically have to tell the parents to kind of calm down a little bit and really make them feel that they're doing a good job, because they are, and not to worry too much about it. So just some tips as a final segue in my talk for today on introducing new foods. It is important. You want to encourage a variety of foods for your child, because every food offers different nutrients that altogether encompass healthy growth and overall health in your child. So when we introduce new foods, you want to do it at a time that your child is actually hungry, okay? Because then they're going to be less selective. They're going to be less picky when you introduce a new food. So be patient. Don't stop trying. When you introduce a new food, it can take 10 to 15 exposures of that food until your child will even consider tasting it. I know it sounds crazy. A lot of parenting is patience, and a lot of it is us learning as opposed to the other way around. So timing is important when you introduce a new food, okay? You also want to be encouraging without pressuring. you want to really encourage self-feeding as soon as possible. So you shouldn't be spoon feeding your child when they're 3 years old. And I see this all the time. My second child, she was in school from age 2 years of age. And sometimes I would peek in the window when I came to pick her up early, and I saw her class of about 10 other 2-year-olds, everyone eating lunch together. The teachers were not feeding any of them. The whole class was self-feeding at 2 years old, which was really nice to see for a change. This is important, and it's okay if it's finger food. It's okay if they're not so adept with utensils, which should be to their size. They should really not be expected to be using the same size utensils as adults, or cups even. But the point is, you want to encourage self-feeding so that they are in control. That's what's really important here. It also helps them become independent. So what I also recommend to a lot of parents is don't talk so much. Just put the food within reach. If your child is playing and it's snack time, bring the plate of the food or the snack, put it in front of them and walk away. Obviously not if it's a choking hazard or, different situation. Of course, I don't mean that. But the point is, don't make it such a big deal. Don't stress on it. Don't put a lot of pressure on the kid to eat the food. Don't say you have to eat this. Don't bribe, force, put pressure on them. Just offer it. And most of the time, you'll come back and you'll see the plate is empty, that they ate it, it was enjoyed, done, really not such a big deal. Lastly, I really encourage you to be creative. So here you have a little picture of an orange that turned into a fish. This is so fun for kids. It really doesn't have to be as fancy as some of the things you see on Instagram. It could be really as simple of cutting a cucumber 3 ways and making it into the shape of the letter N for your daughter whose name is Nancy. They'll get so excited. The point is just, this is fun. This is a fun time for kids. Cutting fruits and vegetables or cheese or eggs into different shapes, making pictures out of the food. It's really gonna be encouraging for your child in a different way. Have fun with it. Go to the store together as they get older. Talk about, oh, do you want a red apple or a green apple? Or don't even ask. Just say, which one would you like to try? Have them be involved, because that's really the start to developing a healthy relationship with food that might be very different from the one that you grew up with. Any questions? Well, I hope you found that somewhat informative. And if you do have any questions later on, I'm more than happy to answer them for you. Thank you so much. Next, we have our second to last giveaway. And of course, I want to keep it kind of nutrition food related, so why not? We have an Oxotot Sprout high chair. You get to choose the color of your choice, which is great. They're going to ship the product right to the winner. It's a high chair that's secure, comfy, and meant to be used for an extended period of time. It actually grows with your child from 6 months all the way up to 5 years. So it comes apart. You can use it as basically just a chair without the top. And all the adjustments that you make with the height and the depth have removable parts that are convertible, and you don't need any tools to adjust it. So that's really great. Okay, and the winner is Nikki Angelique. Congratulations. You just won the high chair. Okay, so without further ado, we have our last speaker of the day, Dr. Sheila Omrani. Before, we had a little technical difficulty, so I'm going to be changing the slides for her, and you just let me know when, okay, Sheila?
Sure. Thank you, Eleana.
Pleasure.
Hi, everyone. My name is Sheila Omrani, and I'm a pediatrician at a private practice in Great Neck called Kings Point Pediatrics. So with the warm weather upon us, I thought it would be a good idea to discuss summer safety for our children and some of the important considerations that we need to consider during this time. I'm going to start by talking briefly about bicycle safety. At this time, I'm seeing a lot of children out on their bikes and scooters while the weather is nice out, and I think it's really important to discuss a few things. Did you know that 85% of bicycle-related injuries could have been prevented by wearing a bike helmet? Unfortunately, a national survey found that less than half of children ages 14 and under actually do wear a bike helmet. Two things that are crucial to bike safety. Number one, make sure your children are always wearing a properly fitted helmet when riding their bikes and scooters. This is the best way to prevent head injuries. Even if they're going to say, Mom, I'm going to go, on the driveway, I'm going to go right in front of the house for 5 minutes. Make sure that they put that bike helmet on, because even during those 5 minutes, God forbid a fall could lead to a head injury that's preventable, fully preventable. When children are riding their bikes, they should always ride on a sidewalk. If there's no sidewalk, have them ride in the same direction as traffic on the right side of the street. Knee pads and elbow pads are always a good idea as well, as they prevent scrapes and burns on those common areas that are always affected in children. Next, I'll be speaking about pool safety. This is a very important topic as the summer approaches. I'm going to be speaking about the many ways we can prevent our kids from having, God forbid, any pool injuries while still enjoying the pool. Did you know that among preventable injuries, drowning is the leading cause of death for children 1 to 4 years of age? So knowing this fact, what are some safety mechanisms we can put into place to keep our children safe always while they're enjoying the water? Number one, nothing beats parental supervision. Nothing. Being within an arm's length of our children while they're in the pool, it's very crucial. Not being distracted by our phones or chatting with other moms. Always keeping an eye on our kids and having them within an arm's length is crucial. Floaties. A lot of parents have a false sense of security while their children have floaties on, thinking that they're safe in a deep pool while they're, lounging or while they're not within an arm's length. Unfortunately, we have to keep in mind that many children, and it's happened many times, less than the age of 2 even, can still manage to take off their floatie on their own. So it should never substitute for direct parent supervision. So now I'm going to be speaking about some things we can do for our at-home pools to keep our children safe. During this pandemic of COVID-19, I'm hearing a lot of parents telling me that they're going to be installing above-ground pools in their backyards, being that the pools may not be open this summer, public pools, and this is going to be a huge issue that needs to be considered while having above-ground pools in our backyards. The American Academy of Pediatrics recommends for parents who have pools in their backyards a fence 4 feet high and around all 4 sides of a pool for complete safety. Ideally, the pool area should be completely cut off and separated from the other areas of the house. So the fence should have no openings or areas that a young small child can get over, under, or through. Also, installing high locks on all doors and windows that lead to the pool area are crucial so that a child cannot wander towards that area while nobody is around, or in the middle of the night, if God forbid they wake up and they linger towards the pool area. Alarms. There are many different kinds of alarms out there for safety purposes. There's alarms that we can install on doors. There's alarms we can install on windows. And obviously there are pool alarms to alert you if anyone has gone near or inside a pool. There are also pool safety nets and covers. There's one company that makes one called Catch a Kid. It's basically like a large tennis racket that is stretched over the pool and then anchored to mounted fasteners as a barrier, so that if God forbid a child jumps into the pool, it's basically as a safety net. Now I'm going to be shifting my gears towards sun safety and talking about some things we can do to prevent our kids from staying safe while outside all spring and summer. Did you know that a few serious sunburns during the course of your child's life can increase your child's risk of skin cancer later in life? So what are some things we can do as parents to prevent this? I'm going to be speaking about babies less than 6 months of age and then children 6 months and older. So according to the American Academy of Pediatrics, infants less than 6 months of age should be kept out of direct sunlight at all times for a couple of reasons. Number one, they have sensitive skin and they're more prone to sunburn. And also, newborns can't regulate their body temperature, so they can overheat easily and they can dehydrate. So what are some things that we can do? They should be kept under the shade at all times, dressed in lightweight clothing, breathable lightweight clothing that covers their arms and legs, and always have a wide-brimmed hat on. Children older than 6 months can be in the sunlight, although the sun's UV rays are strongest between 10 a.m. and 4 p.m. We usually advise that between 10 a.m. and 4 p.m., if you can keep your children in the shade, or if you can have them do indoor activities and then bring them outdoors, or swimming after 4 p.m. if possible, or before 10 a.m. I know that's not ideal. So if they're going to be out in the sunlight during peak sun hours, have them try to stay in the shade as much as possible. Children 6 months and older should also wear long sleeve protective clothing. So like lightweight, breathable shirts or pants, wide brimmed hats, and sunglasses to protect their eyes from UV rays, which can lead to cataracts later in life. If they're going to be going into the pool, you can have them have the rash guard clothing on, which is basically like a long sleeve shirt for going inside the pool. Sunscreen should be applied onto the skin 30 minutes before going outside, not once they're already outdoors, as it needs some time to absorb into their skin and to do its magic. Don't forget the common areas that often parents forget for their children, which are the ears, the noses, the lips, and the top of the feet. Believe it or not, lips do get sunburned and is an area later on in life, as well as the nose and ears, where skin cancer does pop up. So these are crucial areas to protect in our kids. Reapply the sunscreen every 2 hours or after swimming as it comes off. So sunscreen. Common question I get often asked in my practice is, Doctor, which sunscreens are the healthiest and safest for my kids? So what sunscreens are the safest? I'm going to be talking about some definite things that I want you to look for in your children's sunscreens always. Number one, sunscreen should always be broad spectrum, which means it protects against UVA and UVB rays. 2, it should always be SPF 30 and above. So oftentimes I'll get asked, I bought a sunscreen and it's SPF 50. Isn't that the best? So studies have shown that anything above SPF 40 really doesn't offer so much more protection. So if you do find an SPF 40 or 50, that's fine. Don't go crazy about the numbers. Anything above SPF 30 will do. And what should your sunscreen contain? Only 2 ingredients always: zinc oxide and titanium dioxide. These are physical sunscreens known as mineral sunscreens. I'm going to get into that in a little bit. Another thing that I always want you to look for in sunscreen is you should only be buying lotions or creams. I don't like sprays, as they're often sprayed into the air and then they're inhaled by your children or the people that are around you. It's always best to stick to, for the face, a mineral stick, and for the body, a lotion or a cream. So what is the difference between a chemical sunscreen and a physical barrier sunscreen? Many things, and these are all chemicals that I want you to avoid. Parabens, phthalates, BPA, oxybenzone, arobenzone, petroleum. Most of the sunscreens that you see in your local pharmacy, such as Banana Boat, Coppertone, some Neutrogena sunscreens, although Neutrogena has gotten better, are all chemical sunscreens. This means that they use chemicals, such as all of these listed, to absorb into the skin and prevent the sun's rays from penetrating. Physical barrier sunscreens, which have zinc oxide and titanium dioxide, like 2 of the ones that I have pictures of here, do exactly that. They're physical barriers. They sit on top of your children's skin and they deflect and scatter the UV rays. Some examples of physical sunscreens that I really do like, and I use these on my own kids, are Blue Lizard, which has been around for many years. Blue Lizard is a zinc oxide titanium dioxide sunscreen that has been around forever. Think Baby and Think Sport Kids was recently rated one of the top rated in terms of safety and in terms of how well it was doing on our kids. So most of these mineral sunscreens have a stick for the face and then a cream for the body. I actually also really like Trader Joe's. Trader Joe's has a mineral stick for the face, and they have a new lotion or cream for the body. Many companies actually, such as Neutrogena, are also now making their own versions of mineral sunscreen. So just make sure to always read the back. A lot of companies are starting to make sunscreens that only contain these 2 ingredients. Make sure to always read labels when you're using the sunscreen. That's it. Any questions?
I have a question, but I'll wait to see if anybody else
Sure.
has a question first. Or I'll just go right into it. So I actually we invest in the mineral sticks, and I wasn't always sure. When you apply the mineral stick on the face, it kind of looks like a chapstick, and it's very easy to see where you go over because it makes like this thin layer that goes on the skin. But then do you need to actually rub it in, or is that thin layer the protection, the shield against the sun? So if you see that you fully covered, you still need to rub it in.
Yes, rub it in for absorption and maximum efficacy. And also rub it in because there's no need because it leaves a white film. It's like a white thick film on. So my children don't like that, to be honest. They don't like the way it looks. It's embarrassing when we go to pools or we go to friends' houses, or when they used to go to camp. I used to apply it in the morning before camp. Always rub it in so that they don't look like a white ghost.
Yeah, these mineral sunscreen, I think that's why many people kind of avoid them, is because they actually come, especially the creams, they're white, and it's very hard to rub in, and it does. I've walked outside with it on my face, and people have made comments like, there's something on your face. I'm like, yeah, it's sunscreen.
Yes, actually,
as well.
Yes, 100%. You're completely right. Actually, for adults and for us mothers, I actually have a great one that I love from Sephora. It's Josie Moran, or Josie Moran, however you pronounce it. It's SPF 47. It's tinted. So they have 2 bottles. One is white and chalky when it comes onto your face, and one is a tinted moisturizer sunscreen, and it's excellent. It has a little bit of a bronzish hue. If you apply that every day, nobody will know. Along with your moisturizer, nobody will know that you're wearing this chalky white zinc oxide titanium dioxide sunscreen. So I really love this one by Sephora. The other ones that I have experimented with for us as mothers were, you're right, completely white and chalky, and a little bit embarrassing.
It's okay, but that's what they're meant to do, protect us from the sun.
Definitely.
So thank you so much. That was really informative and really great. I appreciate it very much.
Thank you.
Okay, I don't see any more questions, so that was our last speaker for the day. Thank you so much, Dr. Sheila. We have our last giveaway, the highly anticipated stroller, the Lux Tour Plus Zoe stroller. This one you can't pick the color, unfortunately, because I already picked it and they shipped it to me way in advance because I'm the planner that I am. So it's in navy blue. It's really lightweight. It's about 12 pounds only and very compact. The box that came is about this big. I couldn't believe it. So they really pride themselves that it's a travel stroller. It fits in the bin of an airplane, even though I don't know how much of us are going to be traveling in the coming months. I hope I'm wrong. But anyway, it also fits in your car very easily. And what's really great about it, and the reason why I wanted to promote it at this event, is that it's patented to be a tandem system capability, so that you can use it as a single or a double, or you can add the car seat to it with the adapter. And it doesn't have all these extra accessories that you have to pay for, because it all comes together, which is really nice. So you get the cup holders for you get the snack cup for your kid, you get the belly bar, everything comes all together, so that's really nice. And I hope whoever gets it enjoys it. And the winner is Michelle Huckshore. Congratulations. We hope you enjoy your new stroller. So that's the end. I thank everyone so much for spending their Sunday with me, and it's a nice day, so I know that's hard to stay in on the computer when you couldn't be enjoying the sun, especially after all the talk about vitamin D and sun protection. But I really appreciate our amazing panel of speakers. Thank you so much. Again, I know we didn't have so many questions, but as they come to you, please feel free to reach out. The event was recorded, so if you had technical difficulties logging on in the beginning, which I was getting a few text messages, I saw the emails coming in, don't worry about it. It's recorded, so you're going to have access to that, and I'll send you an email as soon as that's available. I want to really thank our sponsors, our virtual vendors who are wonderful, and again, their information is still active and will be remaining listed on my website, pregnantisland.com. So please take advantage, look into them, help each other out, especially during these times. I really appreciate your support, turning this into a community effort. We raised a lot of money for the Essential Workers Fund from the JCC, and I just hope that you were able to have a good time while really learning some valuable information. God willing, next year, if the opportunity permits, we have a physical event, but at least we know that this was an option and we did it, and we couldn't have done it without the panelists, the attendees, the sponsors, the vendors, everybody, the prizes. So thank you so, so much. Hope you have a great rest of your day.
Thanks, Eleana.
Thank you.
Thanks, Eleana.
Thank you, Eleana.
Thank you, everybody, for coming.
Thank you.